work week, Monday through Friday, 9 to 5, and we'll put a booklet in the mail to you. You can read it yourself. You can see the data from our cancer treatment center and that of others, and comparison data, and you'll see who's better. So don't get misled. Don't do the wrong thing, especially if you can avoid it. We're going to take a break for a moment, and we'll be right back with more news and cancer information. This is Dr. Lederman.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and in the good news department, we had a woman who came to us, 70-year-old with fallopian tubes. It's a gynecologic cancer. We spoke about gynecologic cancers earlier in the role of radiation. Well, she went to a famous cancer hospital. She's been there for 5 years. She got, in 5 years, 18 different kinds of chemotherapy, and the cancer grew on every one. She got chemo 1, the cancer grew. They went to chemo 2, the cancer grew. The cancer grew. Up to 18 different chemotherapies in 5 years. The cancer kept on growing. She had surgery and then started chemo, and for 5 years the cancer kept growing, and they didn't offer any other treatment. Finally, she heard about radiosurgery. She had a huge mass in the pelvis and in the lymph nodes by the aorta, which is the main blood vessel from the heart. Her cancer marker test, the CA125, was 6,000. Okay, I just treated her. She just finished her treatments about a month ago. She got a cancer marker. She called me up. It was 55. I said, wow. Now me, the nervous guy, said, well, maybe we should repeat it just to prove it. She said, Doc, I'm really feeling good. I believe it. So we got a PET scan. The PET scan showed the cancer had shrunken by 80%. So we have a cancer marker that's down by almost 95%, 98%, and we had the PET scan showing marked shrinkage. We have a caller now. Just 1 minute. Hello, it's Dr. Lederman. You're on the radio. Yeah, if you want the booklet, just call us at the same number. Call us during the week, Monday through Friday. We'll mail it to you at no charge.
All right, thank you.
Thank you. God bless you, and bye now. So again, if you want that booklet DVD, give us a call Monday through Friday, 9 to 5, 212-CHOICES, which is 212-246-4237. 212-246-4237. That's 212-CHOICES to make it easy to remember. So this woman with a gynecologic cancer, her cancer shrank from 6,000 down to 55. You can do the math. That's a 99% shrinkage of the cancer marker. The mass by PET scan is shrinking and most likely will continue to shrink for the rest of her life. Number one, good news. Number two, good news. Number three, no metastasis anywhere else. So she's in remission, feeling fine. She finally, after 5 years, stopped her chemotherapy. Her hair's growing back. She's feeling great. She's going to work. She's 70 years old. She travels. She's married. She's happy, and she's smiling. She was so happy. Another patient, we're just finishing up treatment, a man with bladder cancer, invasive bladder cancer, and I was offered surgery elsewhere, and the surgery would remove the bladder and the prostate. It would be the end of his urinary life, the end of his sexual life. He came to us for treatment. We have a long history of treating bladder cancer and quite successful treatment. There's been studies that have documented this as well. Signs of bladder cancer. Well, often blood in the urine is a sign. Sometimes people have pain or other symptoms, frequency of urination. This man has invasive bladder cancer, undergoing focused treatment with radiation to the bladder, doing well. His symptoms have gone away, and we only ask him to show up on time. We want his treatments done consecutively because in his case that's how the treatment best works. So we wish him well. And in the good news department, again, we had a gentleman who came in this week. This man is a weightlifter. He has muscles out of this world and huge muscles and veins, and he's a bodybuilder. He's from Egypt, and he had a pituitary tumor. Now, he finished treatment in about March, and his tumor was 1.44 centimeters. A couple days after treatment, almost didn't give a chance for the treatment to work, he got an MRI. The tumor was down to 1.34 centimeters, and now 3 months later he came in with his fiancée, who wants to marry him, so she must be feeling pretty good about his success. The tumor's down to 1.2 centimeters without surgery. So we treat a lot of brain tumors. We talked about acoustic neuromas before. We had another patient who had meningioma this week. This man had a pituitary tumors. These are all benign tumors. We also treat brain cancers like glioblastomas and metastases. We spoke about the woman with a metastasis doing better with a shrinkage of her CEA. So for this man, he's fully functional, no adverse effects, in remission. He's going to come back in 6 months for his next follow-up. He's getting MRIs. There's no radiation with MRIs. He's feeling fine, fully active, and he has a beautiful woman on his arm that wants to marry him, so she agrees. The prognosis is superb. Another gentleman came to us from a big hospital this week. He'd been getting chemo and other treatments for his lung cancer. We staged him up because, number one, everyone should be staged up. You should know if your treatment's working or not working. No one wants treatment that's not working. Like that man who had that vitamins for his prostate cancer and came in kidney failure and his PSA doubling. You need to know if the treatment's working. It doesn't make sense to continue taking treatment if it's not working. This man came to us. He got staged up. He had 2 nodules in the lung and 2 lymph nodes, all consistent with progression of his cancer. He chose to have radiosurgery, and we do treat many people with lung cancers. The beauty is it's usually just 5 treatments, outpatient. Each treatment's about 15 minutes. People walk in, get a treatment, walk out. You don't get the exposure to super bacteria. We're an outpatient center. So the beauty is you come in, get a treatment. The cost is less. The likelihood of getting a super infection is essentially super low because we don't have ICUs and give antibiotics, and those bad bugs are not circulating like in a hospital, and the success rate for him is very, very high. Now here's a man from Texas that probably is listening today. In Texas, he had Merkel cell cancer. Now, he had many cancers in his lifetime. He's 86 years old, and he has family in New Jersey. So he has Merkel cell cancer, and he looks like he has a string of marbles down the right side of his face. So you can imagine where the ear is, and then he's got these red raised nodules, which are Merkel cell cancer, and they've got about 6 or 8 of them down his face from the top of his ear down all the way to the bottom of the mandible. So we're able to treat all of them simultaneously. He's here from Texas. He'll have 5 treatments, and most likely, of course we can't promise anything except we promise to do the best we can, most likely these will go into remission. Now, I saw him on Thursday, and the tumors after 1 treatment only already seemed smaller, but I'll see him again when he comes in next week and report back to you. We treat many skin cancers. This man has about 8 areas. We're treating all simultaneously on his face with focused beam treatment. Standard radiation, by the way, he had you can ask, why didn't he have surgery in Texas and standard radiation in Texas and chemo? He had it all, and it didn't work. The cancer kept on growing despite surgery, despite chemo, despite standard radiation. He had it all. It didn't work. He came to us, where he's getting right now radiosurgery for Merkel cell cancer, a cancer of the skin, and we treat a lot of squamous cancers and basal cancers and metastatic melanoma, which is one of the most malignant, difficult cancers, all with high success rates. And I want to talk just for a couple minutes about a woman with a very difficult gynecologic cancer. She's a woman about 5'2", about 300 pounds. It's hard for her to ambulate because she has lymphedema of both legs, probably from the surgery and standard radiation she had, which didn't work, by the way. So she had complications without benefit. She has cancer growing all the way up and down the vagina, causing tremendous bleeding. So we got that under control. She's got some nodules elsewhere in the body, including in the adrenal gland and some lymph nodes. Her sons brought her in who are really super loving and super thoughtful. Both of them take off the whole day of work to bring her for treatment, and they're really happy that the bleeding in the vagina has stopped with treatment. Now we're moving on to treat the mass in the adrenal gland and then the lung nodules, or actually lymph node nodules. Most likely we'll be able to help her. And how will we prove it to her? Well, again, like everything else, like the bleeding that stopped from the vagina, we'll get scans of her body to prove that the areas that we treated are in remission. That's what our goal is. That's what our hope is. And most likely we'll be able to achieve that. And we had a woman come in from Israel this week who's had a meningioma, what looks like a glomus tumor. So we didn't talk about glomus tumors when we talk about brain tumors, but glomus tumors are tumors from the nerves around a blood vessel. Now, your blood vessels have nerves that control how they function and measure pressure and sometimes shrink. Well, the glomus apparatus is in one of the main blood vessels that go to the brain. We treat many people with glomus tumors. Why? Because number one, the treatment works. We have a long track record, over 20 years. Number two, surgery is very difficult and deforming for this. You can imagine a tumor of the blood vessel going to the brain. This woman has now stable meningioma since 2009, and this glomus tumor seems to be stable as well. So no more treatment, doing well. If those kind of diseases affect you, meningiomas or glomus tumors, you might want to get our booklet. We have a separate booklet about brain tumors, which we'll be happy to mail to you. Just call us during the work week. Or best, really best, is to come in and meet and discuss everything in person. We're going to stop for a moment, hear from some new voices. My name is Dr. Lederman from Radiosurgery New York. We're a cancer treatment center in the heart of New York. We take most insurances, Medicare, Medicaid. So we try to do the right thing for everybody. And if you wish, give us a chance. We'll be right back after this word.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's